you're around, can we start? Perfect. So, its innovation today is on macular imaging. The whole format of this innovation is 5 minutes of introducing your innovation, and then we can open this discussion for the next 2 minutes on discussion. So if you keep your, so just stick to your innovation. Thank you.
Good afternoon, everyone. Thank you, sir. So I'm going to talk about top innovations of 2017. And this is what Time magazine showed as the 25 best innovation of 2017. And it varied from a low vision aid glasses to guilt-free ice cream. But we're not going to be so exotic, so we are going to stick to macular imaging, and more specifically to OCT, optical coherence tomography. There's been a rise and rise in OCT. You can just see how much innovation and work has been done in OCT imaging over the years, with the latest technology being the swept source OCT, the SSOCT, OCT angiography, and where both these come together in the form of OCT angiography using swept source technology. So to put it crudely, why is swept source OCT so good? To put it crudely, sab kuch dikhta hai, you know, everything you can see from top to bottom with this technology. Why is that so? That's so because this light source in swept source OCT is a tunable laser. So we got rid of the spectroscope which is there in spectral domain OCT. There's very high-speed data acquisition, which is twice as fast as the spectral domain. And this helps the tissue to be, penetration to be much better, because the wavelength of light used is 1050 instead of 840. So the whole structure can be seen from top to bottom. And here are the pictures. So you can see in this, the vitreous, you can see how beautifully you can see the premacular vitreous pocket where the arrow is red or arrow is shown, the cells infiltrating the vitreous gel, and the thickening of the choroid below in this patient with an inflammatory pathology, which is VKH. And if you see above, in the spectral domain OCT, all these findings may have got missed. So now we go, let's see how is wider imaging. So this is a patient of ours which we have operated ourselves, which had a tractional retinal detachment. And you can see how nicely you can see the detachment which has resolved the post-op picture below and the pre-op above. Another with a reg RD, you can see the traction on the retina, the retinal layers pulled away, and the resolution post-operatively beautifully imaged in the scan. This is an interesting case of optic disc pit maculopathy, and you can see the good resolution on the swept source OCT and the lessening in the fluid post-operatively. So we've gone wider. Now let's go deeper. So this is a wide field image showing the retinal, showing tracks, and you can see this is CSR, and the choroidal thickness, which should normally be less than 300, is 500 micron. And this is how this technology is letting us go deeper and dig deeper below the retina into the choroid. Another similar case of CSR, and what is very interesting is not just the affected eye, even the fellow eye, you can see the increased thickness with this new technology. Number 2, OCT angiography, basic concept. In the static eye, the only thing which moves in the fundus is the blood which flows through the vessels. And the advantage compared to fluorescent angiography of this is that it can capture this flow layer to layer. It's a depth resolved flow information which is being captured by this technology. It is non-invasive, of course, there's no dye, reduces patient risk, speeds up the exam, and you can do it frequently. You don't have to worry about doing something invasive. It gives 3D-dimensional visualization, high-speed scans, and it is able to capture the depth. So there's just a few tips when we do OCT angiography. Analyze layer to layer, always correlate with the B scan or the NFAS image, and always analyze the video. So I just want to play this short video, and you can see, please see how the cursor is coming down. And when it's going, this is vitelliform, there's just vitelliform material. Is there anything inside the material? And lo and behold, you can see the beautiful vascular network lighting up on the screen in the middle. So this is a case which conventional imaging, we may not have picked up this network, but because of this new imaging technology, we can capture the network itself and treat the patient with anti-VEGF injections. And the third is the amalgamation of these two technologies, which I wanted to highlight. We are amalgamating swept source with the OCTA, getting a swept source OCTA. And this, of course, again has advantages of deeper acquisition and much faster scan rates. It is 100 kilohertz, now it's going to be 400 kilohertz soon. And here we can see how going wider, we're getting a 16 mm scan here, high resolution angiography, a wide field montage here, and this is one of our own patients. You can see how beautiful the wide field, high resolution montage comes. You can appreciate capillary non-perfusion and the tortuosity in this patient of CRVO. A study in iOS has shown how even CNVMs are better picked up with swept source compared to compared to spectral domain. Above, you can see the CNVM beautifully with the swept source, and it may have been missed with the convention technology shown in the slide below. And this is one of our own patients where you can see the beautiful network on the swept source OCT, which has come up. So I'd like to conclude the ICs what the mind knows. Increased resolution in imaging has changed the way we see and perceive retinal structure and vasculature. And this is just the beginning, my friends. There are exciting days ahead. Thank you very much.